Depression has many causes, and you should always discuss the information I gave you with your doctor and your psychiatrist and your psychologist to make an informed decision. I'm going to give you 12 videos to watch. I've interviewed several people who reversed their depression with the carnivore diet. I'm not saying that all depression is related to diet, but what I say is there's definitely a link between gut health and mental health. It's a well-known fact that has been established that if your gut health is not good, you will struggle with mental health as well. I've just uploaded video number 130 on my blog, carnivoreway.blogspot.com. If you click the photo profile, you'll find my blog link, carnivoreway.blogspot.com, or look in the video description of this video if you see this on YouTube or Facebook. You scroll all the way down to video 130. It's the last video that I've uploaded. The videos are numbered on the left. This is for Dr. Caroline Leaf. She has 38 years experience as a psychologist, and she explains depression like you've never known it or heard it. She talks about bipolar as well. In that particular video, she says that you are not your disease. You are not depression. You are not bipolar or whatever other problems you might have. The trouble with modern medicine is they give people labels, and it basically tells them you're going to be on medicine for the rest of your life. This is your label, this is your identity. And she is completely against. The first thing that she say is that depression is not a disease. Now, that might ruffle some feathers, but she say depression is not a disease. Bipolar is not a disease. She say it's a symptom. It's a symptom of underlying problems that need to be addressed. And go and listen to this video. I don't want to elaborate too much on that video number 130, but it's well worth to watch it. She has a system of helping people and a program, and it's of benefit to know. The title of the video is Heal Yourself. You know, so you can heal yourself from depression. You can heal yourself of bipolar. You must believe it, that it's possible. Dr. Caroline Leaf in video 130 talk about the so-called chemical imbalances. And she say the chemical imbalances, the so-called chemical imbalances, was a marketing ploy from pharmaceutical companies. It is now established that serotonin that is given to patients does not help for depression. What does happen is all these chemicals that you are given does cause brain altering functions, and you might get benefit from that, but it's not proven that serotonin actually helps for depression. In fact, you get a serotonin drop if you use these drugs that they prescribed, and then you get a more severe depression. It's also habit forming. It's also dependency forming. But check out video 130. As I say, I don't say stop your medication. What I say is discuss it with your doctor. Look at the carnivore diet, because if you consider the fact that nutrients and chemicals come from the food that you ingest. So if you can follow a proper human diet, like the carnivore diet, and you can cut out inflammation-causing substances, defense mechanisms that are found in plants, like lectins, oxalates, and many other defense mechanisms, plant hormones, and of course the high sugar levels that we are cutting out, the high carbohydrates, the seed oils, unsaturated seed oils that we are cutting out and avoiding with the carnivore diet. The carnivore diet is the ultimate elimination diet. But like I said, depression has many causes. There can be life circumstances that happen to you that caused your depression. Your diet will not make the depression or the depression that you experience less. It cannot. But how you deal with it will become better. Your anxiety, for instance, will reduce. I've interviewed several people on this topic, and I've got several videos on my blog, which I will refer to now, where people discuss how they reverse their depression, how they reverse their anxiety, how they reverse their bipolar, etc., with the carnivore diet. Like Dr. Carol Leaf say in video 130, one of her patients stated it best. The patient said afterwards, she or he said, that my problems are still the same. My real life problems are still the same. But now I can handle them. They're just as bad, but now I can better handle them. And I think that's what it's about. We live in a world that has a lot of problems. Life happens, and we all have problems, and we all have things that makes us anxious and make us depressed. And one thing I picked up in Dr. Carol Leaf's interview, video 130 on my blog, she say that depression is not necessarily a bad thing. It's a coping mechanism, a defense mechanism that your body has to try to deal with something. But go and look at that video. So let's get into the videos that I want you to watch. The first video is video number 5 on my blog, carnivoreway.blogspot.com, where Joe Rogan interviews Professor Jordan Peterson. He reversed his depression. Michaela Peterson, his daughter, reversed her depression with the carnivore diet. Go and check this video out. Very well-known professor, Jordan Peterson, being interviewed by Joe Rogan. Video number 5. Video number 6, Brett Lloyd. He was depressed for 40 years. He was on 8 different medications. He suffered from anxiety. Within 23 days of the carnivore diet, doing the carnivore diet, he stopped all his medication. 6 months into the carnivore diet, all his anxiety symptoms disappeared. His depression went away within 23 days mostly. And then within 6 months, his anxiety went away. Let me explain. Inflammation manifests itself in various places in the body. Inflammation can manifest in your digestive tract. Inflammation can manifest in your joints. It can manifest in your brain. Brain inflammation is a cause of many problems in the body. In these videos that I'm going to mention, you'll learn more about that. Brett Lloyd is so strict with his carnivore diet. If he drink something sweet accidentally, he will spit it out immediately, because he cannot risk his mental health, he says. Type 2 diabetes. There's a link between type 2 diabetes and mental health as well. It's a well-known fact that many people who suffer from type 2 diabetes in the end develop mental problems, forgetfulness, Alzheimer's, dementia, etc., because the sugar destroys the brain. It's a very high percentage. So mental health and diabetes, there's definitely a link, and insulin resistance. There's absolutely a link between insulin resistance and mental health as well. As well as high uric acid levels. I've talked many times about that. High uric acid levels in the brain causes your veins to become not elastic, so you lose your elasticity in your veins, and you have a 55% chance of developing Alzheimer's or dementia if you have high uric acid levels. So with the carnivore diet, we get rid of that. So check out this video number 6. Discuss it with your doctor to reduce your medicines as it's needed. That is what I say. Then check out video number 10, where 2 of my doctors talk about mental health and the carnivore diet on my blog. Check out video number 29, where Amber O'Hearn, who is a data scientist, talks about how she reversed her depression and bipolar with the carnivore diet. She is a 10-year carnivore diet follower. Go and check out video number 29 on my blog. Video number 52, 55, and 56. Check it out. I've done an interview with Stephanie Jones. That is also video number L2 and L3 on my testimonial playlist on my YouTube channel. So that is somewhere else. My YouTube channel, I've interviewed people and I've uploaded my own interviews on my testimonial playlist on my YouTube channel. So if you look on the tab, or if you scroll down, you'll see my frequently asked question playlist, and then just below that you'll see or beside that, or below that, depends, you'll see my testimonial playlist, where I've interviewed many people for various diseases and symptoms or disorders that they suffered. And one of those is Eric Sartori. He's a friend of mine. He's a nurse. And that video is video L14. But that is not on my blog. That is on my YouTube channel. So Stephanie Jones's video is on my blog, but also on my YouTube channel, on my testimonial playlist. That is L2 and L3. But Eric Sartori, who is a male nurse who reversed his depression with the carnivore diet, is video L14 on my YouTube channel. Kobus Kriel with a C. And that is video L14. Then check out video number 59 back on my blog, where Dr. Berry talks about depression and anxiety and bipolar as well. So how strict should you be with your carnivore diet? Check out video Q40 on my frequently asked question playlist on my YouTube channel, where I talk about how strict you should be. Some people need to cut out dairy. Dairy can cause inflammation, especially milk. Milk has too much carbohydrates in it. A liter of milk has 47 grams of carbohydrates in it. So some people who suffered from depression needed to cut out, first of all, milk, and some of them had to cut out dairy completely. So the fat part of milk is good, and you will still be able to eat butter, and the people that cut out dairy were still able to consume butter. But for the most part, try to avoid milk if you suffer from inflammation in any part of your body, especially in the brain, and you'll see the benefit of that, because the milk sugars can also cause you to stay carb addicted. With other words, your cravings stay, and that is bad for your depression. So yes, you can get cravings on the carnivore diet if you don't do it strict enough. So the stricter you will be with your carnivore diet, the easier you'll make it for yourself. Yes, there's an adaptation phase, and yes, your cravings will go away. But if you continue to add in things that cause you to have cravings, like for instance sugary sauces, or maybe you add milk, etc., then you make it difficult for yourself. So make it easy for yourself. The stricter you will be with the carnivore diet, the better you will do. Using butter can actually be very helpful. I found that when I stopped drinking milk, my cravings went away, but I started to use more butter, and I use it even in my coffee. I make bulletproof coffee, and it helps me quite a lot. I even take a bit of butter on the side sometimes. Butter has 0 carbohydrates in it, and it's full of vitamin D, which is good for your brain. It's full of cholesterol, which is good for your brain. Did you know that 30% of your body's cholesterol are within your brain? So your brain manufactures all of that cholesterol by itself. So don't let them put you on statins. If you're on statins, discuss it with your doctor. But I've got a video about cholesterol. Check it out on my frequently asked question playlist. And as always, discuss it with your doctor. But cholesterol is very important for brain health. And the risks of heart disease is type 2 diabetes and hypertension. You may not have hypertension, but if you have type 2 diabetes, you absolutely want to reverse that. And if your kidneys are still working fine, you can do the carnivore diet. I've got a video how to start the carnivore diet. I've got a video who can do the carnivore diet. Check it out on my frequently asked question playlist.